Those who've dedicated their life to achieving sporting prowess, winning is everything. Seduced by fame and sporting deals, many have been pressured into dangerous culture. In 2013, the World Anti-Doping Agency released their anti-doping testing figures laboratory report, where diuretics were the third most commonly used drugs in sport, of which furosemide and hydrochlorothiazide were the two main commonly used diuretics. So what are these drugs? How do they work? What advantages do they give to our athletes? And are they causing more harm than good? To answer these questions, we asked Dr. David Kalatzis, a world-renowned leading expert in diuretics.
Diuretics are a class of drug that increase the volume of urine produced by promoting the excretion of sodium and water from the kidneys. Furosemide targets the loop of Henle in the nephron of the kidney. The loop of Henle is where 25% of sodium reabsorption occurs. The part of the loop of Henle that is targeted by furosemide is the thick ascending limb. It specifically targets the sodium, potassium and chloride co-transporter NKCC2. Furosemide inhibits this co-transporter, which leads to a decrease in sodium reabsorption into the basolateral interstitium. This is our body. The decrease of sodium reabsorption also leads to a decrease in water reabsorption due to osmosis. In effect, this also leads to an increase of sodium and water in the lumen for excretion by the kidney. Hydrochlorothiazide targets the sodium chloride co-transporter SLC12A3 in the distal convoluted tubule, where 5% of sodium reabsorption occurs. So hydrochlorothiazide actively inhibits the sodium chloride co-transporter, leading to a decrease in the rate of sodium reabsorption into the basolateral interstitium, which is the body again, and an increase in sodium and water levels in the lumen for excretion by the kidney. So overall, the furosemide targets the thick ascending loop of Henle, where 25% of sodium reabsorption occurs, and hydrochlorothiazide targets the distal convoluted tubule, where 5% of sodium reabsorption occurs. So because of the factors of 5% sodium reabsorption and 25% sodium reabsorption, furosemide is the preferred drug of use found by the laboratory report by the World Anti-Doping Agency, and then hydrochlorothiazide comes in second. The side effects of the diuretics are shown here by the decrease in blood volume and electrolyte imbalance. The decrease in blood volume is caused by the increase in water excretion and the decrease in sodium reabsorption into the body, so increase in sodium excretion as well. The electrolyte imbalance is also caused by the increase in sodium excretion. This increase in sodium excretion is profound on the collecting tubule, where potassium and hydrogen are actually lost as well because of the increase in sodium. That explains the hypokalemia, hyponatremia, and metabolic alkalosis is also explained by this and by the action of these diuretics on the chloride co-transporter. Hyperuricemia is also seen because uric acid is precipitated in the body rather than being excreted. There's a lack of evidence of performance-enhancing advantages of these diuretics in the literature. However, there were noted advantages of the diuretics to give reason for their use. So weight loss was a noted advantage because of the increased fluid excretion. Increased fluid excretion means decrease in blood volume. Decrease in blood volume leads to a decrease in weight loss. This weight loss is good for sports which involve weight requirements like boxing and wrestling. It's used as a masking agent because of the increase in fluid excretion leads to a diluting effect on other drugs that could be used. In fact, in the same year the laboratory testing figures were released, an athlete was suspected of abusing this advantage.
Veronica Campbell-Brown, the world champion at this distance.
Veronica Campbell-Brown, a track runner, tested positive for furosemide. She claimed the diuretic was used for health reasons. Given the advantageous use of the diuretic as a masking agent, she may well have been using it to cover up the use of performance-enhancing drugs.
In summary, the findings of the World Anti-Doping Agency in the anti-doping testing figures of the laboratory report in 2013 found that furosemide was the most commonly used diuretic because of its increased efficacy when compared to other drugs such as hydrochlorothiazide.